Look at your nails right now. If you are over 50 and they look pale, yellow, bluish, thick, brittle, curved, or strangely different from how they used to be, your body may be trying to warn you about something deeper. Not later, not tomorrow, right now. Look at their color. Look at their shape. Look at whether they are smooth or rough. Look at whether they break easily. Look at whether they have changed in the last few months or years. Now ask yourself one simple question. Have my nails changed after 50? Most people notice these changes and immediately blame aging. They say, well, I'm getting older. Of course my nails are different. But what if that is not the full story? What if your nails are not just changing because of age? What if they are quietly revealing something your body has been trying to hide? A problem with your blood, a problem with your circulation, a problem with your liver or kidneys, a problem with your blood sugar, or even a problem with how much oxygen is reaching your tissues. This is why your nails matter so much after 50. Because your nails are not dead decorations at the end of your fingers. They grow from living tissue. At the base of each nail, there is an area called the nail matrix. This is where new nail cells are produced, and that area depends on blood flow, oxygen, nutrients, hormones, and the overall health of your body. So when something inside your body begins to change slowly, your nails may be one of the first places where that change becomes visible. The problem is that most people are never taught how to read those signs. They cover them with polish, they cut them shorter, they blame dry weather, they blame aging, they buy a nail supplement, but they never ask the deeper question, why did my nails change in the first place? I'm Dr. Michael Carter, and in today's video, I want to show you 4 nail changes that adults over 50 should never ignore, because they may be connected to 4 hidden health problems that often develop quietly. And the 4th sign is one of the most overlooked. It can appear at the base of the nail near the cuticle, and many people live with it for years without realizing it may be connected to something happening inside the body. Before we go further, take a second and write your age in the comments. And tell me this. Have you noticed any change in your nails after 50? Pale nails? Yellow nails? Thicker nails? Brittle nails? Blue or purple color? White lines? Or nails that suddenly look different from before? Write it in the comments, because your answer may help someone else realize they are not alone. And if you find this type of health information useful, leave a like on this video so it can reach more people who need to hear it. Now, before we talk about the 4 diseases, you need to understand something important. A nail sign by itself does not automatically mean you have a serious illness. This video is not here to scare you. It is here to help you pay attention, because one nail change can happen for many simple reasons: aging, trauma, frequent hand washing, fungal infection, medication, dehydration, or even nutritional changes. But when a nail change is persistent, when it appears together with fatigue, shortness of breath, swelling, dizziness, numbness, slow healing, weight changes, or unusual weakness, that is when your nails stop being just a cosmetic issue. They become a clue. And after 50, clues matter. Because many diseases do not begin with dramatic symptoms. They begin quietly. A little more tiredness, a little less energy, a little more shortness of breath, a little more swelling, a small change in skin color, a nail that no longer looks the same. And because these signs are subtle, many people ignore them until the condition becomes harder to treat. So today, we are going to look at 4 nail changes and the 4 hidden diseases they may point to. Number 1 is pale or spoon-shaped nails. This may be connected to anemia or iron deficiency. Number 2 is yellow, thick, or slow-growing nails. This may be connected to diabetes, fungal infection, or poor circulation. Number 3 is bluish nails or rounded fingertips. This may be connected to oxygen problems, lung disease, or heart strain. And number 4 is a change near the base of the nail, including disappearing half moons or unusual white patterns. This may be connected to kidney, liver, or blood-related problems. Stay especially focused on number 4 because it is the one most people never check. And once you see it, you may never look at your nails the same way again. This is one of the most important nail changes to understand after 50 because it can be connected to a problem that many people live with for months without realizing it: anemia. Anemia happens when your body does not have enough healthy red blood cells or enough hemoglobin to carry oxygen properly through your blood. And when your tissues are not getting enough oxygen, your body may begin to show small signs long before you feel seriously ill. One of those signs can appear in your nails. Your nails may start looking unusually pale. The normal pink tone under the nail may fade. The nail bed may look almost white. And in some cases, the nail may begin to curve inward, almost like a tiny spoon. This is called spoon-shaped nails. Some people notice it when a drop of water can almost sit on top of the nail without rolling off. Now, this does not mean that every pale nail is anemia. Cold hands, poor lighting, aging, or even natural skin tone can change how your nails look. But if your nails used to have a healthy pink color and now they look consistently pale, if they break more easily, if they feel weaker than before, and especially if you also feel tired, dizzy, short of breath, unusually cold, or weaker than normal, then your nails may be giving you a clue that your blood needs attention. And this matters because after 50, anemia is not something to ignore. Many people think anemia only means low iron, but anemia can have several causes. It can happen because you are not getting enough iron, vitamin B12, or folate. It can happen because your body is not absorbing nutrients properly. It can happen because of chronic inflammation, and in some cases, it can happen because of slow internal blood loss that the person cannot see. That is why the nail sign matters, not because the nail itself gives you the final diagnosis, but because it may be the first visible sign that something deeper deserves investigation. Let me give you an example. Imagine a woman named Patricia, 62 years old. For most of her life, she had strong nails. She never paid much attention to them because they were always normal. But over the last year, she noticed they became weaker. They started splitting at the edges. The color looked paler than before, and the surface of some nails looked slightly dipped in the middle. At first, she blamed cleaning products. Then she blamed age. Then she bought a nail hardener. But nothing really changed. At the same time, Patricia was also feeling more tired than usual. She needed to sit down after simple tasks. She felt a little breathless when climbing stairs. And she started feeling cold even when other people in the room were comfortable. But because the symptoms came slowly, she did not see them as a problem. She simply thought, "I'm just getting older." During a routine checkup, she finally mentioned the nail changes to her doctor almost as a side comment. Her doctor looked at her nails, asked about her energy, and ordered blood work. The test showed anemia, and once the cause was investigated, she was able to begin treatment before the problem became more serious. That is the point I want you to understand. Your nails are not diagnosing you, but they may be warning you to ask better questions. So here is what you should look for. Look at your nails in natural light near a window if possible. Do not check them in yellow bathroom light or under harsh artificial lighting, because that can change the color. Look at the nail bed. Does it still look pink, or does it look unusually pale compared to before? Now look at the shape. Are your nails flat? Or do they appear slightly sunken in the middle like a spoon? Then ask yourself, have I also been more tired lately? Have I felt dizzy when standing up? Have I felt short of breath doing things that used to be easy? Have I felt unusually cold? Have I noticed faster heartbeat, weakness, or low energy? If the answer is yes, do not panic, but do not ignore it either. The right step is simple. Bring it up with your doctor and ask whether a complete blood count, iron studies, vitamin B12, and folate levels may be appropriate. These are common blood tests, and they can help reveal whether your nail changes are connected to anemia or a nutritional deficiency. Now, number 2 is very different, because while pale nails may point toward a blood or oxygen problem, yellow, thick, slow-growing nails may point towards something many adults over 50 are silently struggling with every day: blood sugar, diabetes, and poor circulation. And this is where many people make a dangerous mistake. They assume yellow or thick nails are only a cosmetic problem. They think it is just fungus. They hide it. They cover it. They avoid sandals. They cut the nail shorter and move on. But after 50, thick yellow nails can sometimes be more than a nail problem. They can be a clue that your body is having trouble with circulation, immunity, healing, or blood sugar control. And that is exactly what we need to talk about next. Number 2 is yellow, thick, or slow-growing nails. And this is one of the most misunderstood nail signs after 50. Because when most people see a yellow nail, they think only one thing: fungus. And yes, fungal infection is very common. It can make the nail look yellow, thick, crumbly, uneven, or harder to cut. It can start on one nail and slowly spread to others. And for many people, especially after 50, it becomes something they hide instead of something they talk about. They stop wearing sandals. They cover their feet. They cut the nail shorter. They buy creams from the pharmacy. They pretend it is just cosmetic. But here is what many people do not realize. Sometimes yellow or thick nails are not only about the nail. Sometimes they are a clue that the body is having trouble with blood sugar, circulation, immunity, or healing. And this is especially important after 50, because type 2 diabetes can develop quietly for years. Many people do not feel sick at the beginning. They do not have pain. They do not collapse. They do not wake up one day suddenly knowing their blood sugar is high. Instead, the signs appear slowly. A little more thirst, a little more fatigue, a little more urination at night, a small cut that takes longer to heal, numbness or tingling in the feet, and sometimes changes in the nails. When blood sugar stays high for too long, it can affect the small blood vessels and nerves, especially in the feet and hands. It can also weaken the body's ability to fight infections. That is one reason fungal infections may become more frequent, more stubborn, and harder to clear in people with uncontrolled blood sugar. So if your nails have become yellow, thick, brittle, slow-growing, or unusually hard to trim, especially if this is happening together with slow healing, tingling, numbness, burning in the feet, increased thirst, or waking up several times at night to urinate, that is not something to ignore. It does not automatically mean diabetes, but it does mean your body may be asking you to look deeper. Let me give you an example. Imagine a man named Robert, 57 years old. For years, he noticed one toenail becoming yellow and thick. At first, he blamed tight shoes. Then he blamed age. Then another nail started changing. Then another. The nails became harder to cut. Some looked crumbly at the edges. And because there was no major pain, Robert kept postponing it. He told himself, "It's just a nail fungus. I'll deal with it later." But around the same time, he also noticed that his feet felt colder than before. Sometimes he had a mild tingling sensation at night. Small cuts on his toes seemed to take longer to heal, and he was waking up more often to use the bathroom. None of these symptoms felt dramatic by themselves, but together they were telling a story. When Robert finally went to his doctor, his blood work showed that his blood sugar had been elevated for a long time. The nail problem was not the only sign, but it was one of the signs he had been seeing every single day and ignoring, and that is the lesson here. After 50, you should not panic over every nail change, but you should never dismiss persistent nail changes when they appear together with other body signals. Because your nails may be showing you what your blood vessels, nerves, immune system, and metabolism are already experiencing internally. Now, there is another important detail. Yellow nails may also be connected to circulation problems. When blood flow to the extremities is reduced, nails may grow more slowly. They may become weaker. They may become thicker or more fragile. And the surrounding skin may look dry, shiny, cool, or poorly nourished. This is why you should not look at the nail alone. Look at the whole pattern. Are your feet often cold? Do your toes change color? Do you feel heaviness, cramping, or fatigue in your legs when walking? Does it get better when you stop and rest? Do small wounds take longer to close? Do your nails grow much more slowly than they used to? If several of these signs are present, Your doctor may want to check your circulation, because poor blood flow in the legs and feet can be a warning sign for broader cardiovascular risk. And here is the part many people miss. The same body that sends blood to your toenails also sends blood to your heart, your brain, your kidneys, and every other organ. So when circulation is poor in the feet, it can sometimes be a sign that the vascular system needs attention. Now, let's make this practical. Tonight, when you take off your socks, look at your toenails under good light. Do not just look quickly. Really examine them. Are they yellow? Are they thick? Are they crumbly? Are they lifting from the nail bed? Are they growing much slower than before? Are several nails affected, not just one? Now look at your feet. Is the skin dry or cracked? Are your feet often cold? Do you have tingling or numbness? Do you have swelling? Do cuts take longer to heal? If you notice yellow, thick, or slow-growing nails together with these symptoms, bring it up with your doctor. Ask whether it makes sense to check your blood sugar with tests such as fasting glucose or A1C. Ask whether your foot circulation should be evaluated, and if you already have diabetes, do not treat nail changes as a small cosmetic issue. Foot and nail changes matter, because people with diabetes need to protect their feet carefully. A small problem that seems harmless can become more serious if circulation, sensation, or healing is impaired. Now, this does not mean you should be afraid of your own nails. It means you should respect the signs your body gives you, because there is a big difference between fear and awareness. Fear makes you avoid the problem. Awareness makes you take the next right step. And for yellow, thick, or slow-growing nails, the next right step is not to hide them. It is to ask, is this only a nail infection? Or is my body showing me something about my blood sugar, circulation, or immune system? That one question can change everything. Now, number 3 is one of the most important signs in this entire video. Because while yellow or thick nails may develop slowly over months or years, a bluish color in your nails can sometimes point to something much more urgent. Oxygen, circulation, your lungs, and your heart. And this is the sign many people see, explain away, and regret ignoring later. So before we continue, look at the base of your nails again. Do they look pink, or do they have a bluish, purple, or gray tone? Because that color may be telling you something your body cannot afford for you to miss. Before we continue to the next nail sign, I want you to do something simple. Look at your nails again, not with fear, not with panic, but with attention, because sometimes the body whispers before it screams. And the problem is that most people ignore the whisper. They ignore the pale nail. They ignore the yellow nail. They ignore the thick nail. They ignore the slow healing. They ignore the strange color. They ignore the small changes because they seem too simple to matter. But after 50, small signs can carry big messages. And the goal of this video is not to make you afraid of your own body. The goal is to help you listen to it sooner. So if you have noticed any change in your nails recently, write it in the comments right now. Tell me your age and what you noticed. Are your nails pale, yellow, thick, brittle, bluish, curved, slow growing, or different from how they used to be? Your comment may help another person watching this video realize they are not alone. And if this video is helping you understand your health in a clearer way, please subscribe to the channel. Here, we talk about simple warning signs, healthy aging, and the small daily changes that can protect your body after 50. Also, share this video with someone you care about, a spouse, a friend, a parent, a brother or sister, because many people will never search for this information on their own. But if this video reaches them at the right time, it may help them notice something important and speak to their doctor before a silent problem becomes serious. And one more thing. Do not use this video to diagnose yourself. Use it to become more aware. Use it to ask better questions. Use it to have a more informed conversation with your doctor, because your nails are not the final answer. They are a clue, and sometimes one small clue is enough to help you take action at the right moment. Now let's move to the next sign, because number 3 is one of the most important nail changes to recognize after 50. If your nails, lips, or fingertips ever look bluish, purple, or gray, Your body may be telling you something about oxygen, circulation, your lungs, or your heart. And this is one sign you should never ignore.